So before we attach the neurostimulator and the tacks, we do want to add adhesive just to make sure that it stays in place for as long as possible. Well, I should say throughout the 12 days of wearing the device. We use Mastisol, crafty little thing. And what I will do is I will put the Mastisol behind the patient's ear where the device will sit, the battery rather. I need to get some more. There we go. So we'll start with that first. I will attach the battery. So we'll take off the sticker, and this sticker is then placed in the patient's chart, on the patient's chart. So we'll keep that. We'll attach the battery. Right behind the patient's ear. Give it a minute and let it sit. Okay. Now, just a friendly reminder, right? These are tacks. So I suggest keeping the tacks within this case until you're ready to apply them to the patient's ear, just so they don't get a little sting on their shoulder in the interim. But we will start with the ground tack. So recall the ground wire is off here separately from the others. So we'll start here. We'll take this tack. It's convenient and just better for everybody if you do. See how it just easily makes this little circle here? So we're going to attach this with these kind of hanging off to the side to the back. Where we found that ground before. So that is established. Do you feel that? Doing okay? Mm-hmm. Okay. Kind of make sure that it's stuck on there and your glove does not stick to it. Okay. Now the next step with this is we have to tape this ground wire down. And this is another kind of anomaly, right? So since we're on the left ear here, sometimes this gets tangled just with the way the device was created, not a problem, but we don't want when these additional tacks to get on the ear for any cross wires to occur. So in this case, which again happens sometimes, we'll just go through here, and then you've separated now the ground wire from the additional 3. No connection whatsoever. So I'll take a piece of tape, and then, thank you, just tape this down. Oh, thank you so much. Right like that. Less hair as possible, of course. Yeah, make sure that tack stays in there. Here, thank you. You can let that go. We're good. Now, honestly, the trickiest part is taking off this white thing from the tape and not taking any hair with it. Awesome. Done. Ground wire complete. And now we can attach the additional tacks up. So what I like to do is start from this tack and go from the lowest point, and then as we move forward to the highest. So we'll start with this one. And some of these have a mind of their own, so just kind of let it do what it wants to do for the most part. But then let's make another circle, right? So as long as we can make those it's almost like elongated hoops, right? Just that they all can be together, just similar to the ground. And we'll attach this here first. This will cause a little pinch. We're in there. You good? Mm-hmm. Awesome, you're doing great. There's one done. We'll do the second one a little higher up. You good? Okay. And then lastly, so we are done. So we've got all of the tacks in the ear, and now we just assure that it stays for the entirety of the pulsating of 12 days. So we'll then use steri strips to just keep a good connection. I think they like my gloves. I'll get behind here again as well. And so this is another time to remind you guys that obviously with a battery and wires connected to you, no getting it wet or washing your hair for the entirety of the device. That's 12 days in your case. A lot of dry shampoo.
Right.
No worries. Fluff it up and yeah, some dry shampoo. Honestly, to your advantage, since these are so far in there, I don't think they're coming out. Okay. Actually, can I have that cut in half? Now we'll just tape down the wires. Thanks. And then I'm going to put another steri strip on here just to make sure that these additional wires kind of in front of your earlobe don't get stuck on anything, okay? We'll also send you home with some.
Okay.
Just as
Just in case.
Yeah. How are you doing? Are you doing okay?
Yeah. Good.
So sometimes the patient feels a pulsating right when we attach the tacks. Are you feeling anything yet?
I felt it at first.
At first, felt a little.
I don't feel it anymore.
Oh,
No.
good. That's okay. Well, sometimes it takes longer than others, but it's all part of the process. Okay. So now we have to do one more tegaderm. That is going to go on the battery behind the ear. It'll be probably the biggest piece of tape we use.
Okay.
So that'll just conceal the battery to water or to other kind of outside moisture. And I might have you move your head a little bit this way, please. Thank you. Perfect. So that'll go like that. We just have to cover the entirety of that battery. That's really less about attaching it to your skin and more so covering that plastic shield on there. Okay. Now lastly, we have to make sure the battery can breathe, doesn't overheat or anything crazy. And so how we do that is I'm just going to cut a little sliver into that open face there to keep the breath, the battery. Just needs to be a little hole. That's why we can't have you take a shower, honestly.
Okay. Yeah.
All right. So you are done.
Wow.
I can take this out.
Pretty simple.
Yeah, and honestly, just be very careful when you put your hair behind your ears because you do have wires here.
Okay.
But honestly, besides the 3 tapes on your ear, you can't even see it.
Good.
Yeah. I wish you the best. It's going to be great.
Yeah. No, it was pretty painless.
Painless?
Actually, yeah. Just a little pinch. That's it. What you told me.
Yeah. Well,
So-
here's to no pain.
Well, yeah, that would be wonderful.